Welcome back to another episode of Chai, Chat and Community. I'm Saleha, and today we are talking about something that a lot of people feel shy or awkward about bringing up bowel health. But the truth is, these conversations are something that every household should be having. Whether it's constipation, bleeding, or changes in bowel habits, ignoring symptoms out of embarrassment can delay diagnosis and make things worse. I want to start with something that's deeply personal. A couple of months ago, I developed hemorrhoids, not pretty embarrassing, and it was incredibly painful. I remember the discomfort, the sleepless nights, and honestly, the embarrassment of even talking about it. My guest today, Dr. Suat Chin Ng, was my surgeon. Her care, compassion, and guidance made all the difference in my recovery. Hemorrhoids are something, as Suat said to me, both men and women experience. Yet so many people suffer in silence, and that silence can stop us from getting help early. Today, we'll talk about bowel health, including hemorrhoids and the rise of bowel cancer, particularly, as Suat said to me, among younger people, including those as young as 15 to 29 years old. We'll also tackle some common myths, including one I've heard a few times about whether vaccines may have played a role in the rise of colorectal cancer. So grab your chai and settle in. This is going to be a warm, honest, and hopefully empowering conversation. So thank you so much for joining me. I cannot thank you enough.
Oh, thank you very much. It's a pleasure being here.
So before we discuss very important issue, not issue, a subject, let's talk about you. Why surgery? Why colorectal surgery? Especially, this is a field that many people are still hesitant to even talk about.
That's true. It's not the most glamorous sounding field, but for me, I feel that colorectal surgery just feel right from early on. I've always loved the anatomy, the structure, the detail, the need for precision. And the bowel has this incredibly intricate anatomy that both is beautiful but also unforgiving. So
Oh yes,
you
very
always have to
unforgiving.
be you always have to be in the exact plane, and or things can go wrong very quickly. So I'm also drawn to the oncology side of things. My patients come in with bowel cancer, often feeling frightened, but the reality is that many are still very curable. And being able to offer hope and guide someone through their journey, that I feel that that's a privilege that I don't take lightly. I
Awesome.
was raised with a sense of mindfulness and compassion. The idea that respect of others starts with how you show up for them, and whether it's a patient, a trainee, a colleague, a family member, I try to bring the same attentiveness. So surgery to me is not just technical; it's also deeply human. I've been fortunate to work with mentors who have reminded me that while precision saves lives, it's compassion that actually
Absolutely.
heals the people. So that balance, bringing mindfulness into surgery, I feel is what actually keeps me in this field.
Wow. I know about your compassion when I was going through the pain and I just called you up. That made so much of a difference. I knew what to expect. So yes. And that is how the whole conversation started about, how we should talk
Mm,
about something that so many of us go through, but we never talk about it because we are embarrassed. I was embarrassed. I was very embarrassed
mm.
when, yeah. But anyway, so hemorrhoids are very common, yet people are embarrassed, like we're talking about. And how common are they? And why do you think there's still so much of stigma around them?
Well, hemorrhoids, honestly, is one of those things that hardly anyone wants to talk about. Yet almost everyone experiences them at some stage in their life. They're incredibly common. Around half of the adults will have them at some stage. They're basically swollen veins around the bottom, a bit like varicose veins, if you like it, just in a spot that most of us don't really talk about openly. Why the embarrassment? I guess anything to do with our bottoms or toilet habits often still feels a bit of a taboo. And we'll happily talk about our sore knees, our sore back, our blood pressure. But when it comes to bowel habits, people just go very quiet. There's still a bit of that kind of old-fashioned shame attached to it, which really isn't helpful in this situation. The truth is, hemorrhoids are a normal human condition. They can happen from straining in the toilet, during pregnancy, when you're pushing the baby out, or simply with age and gravity. So there's nothing really unclean or unusual about them. The main thing is don't suffer in silence, is what I would like to tell the patients. Doctors sees this type of situations all the time. There's plenty that can be done to help. The sooner you mention it, the quicker we can make sure it's nothing serious and help you feel better.
Thank you. Yeah, thankfully mine was just over a week, but that 1 week and the 2 weeks after was like, and it is painful. I mean, if we won't
It
try
is
and
painful.
sugarcoat it,
Yeah.
and yeah, so yes. So at what point should someone stop doing home remedies and seek professional help? Because for some, it can be a feeling of discomfort, noticing the symptoms. And what do you think are the early signs of a hemorrhoid?
Well, early signs can often includes bleeding. You may get some itching or irritation around the area. You feel a bit of pressure or lump popping out when you're pooing. The blood that tends to come out tends to be bright red. Sometimes large volume, sometimes smaller volume, and you sometimes may also have a feeling that you haven't completely emptied your bowel, so you feel like you still have something there. These symptoms are very common and often related to hemorrhoids, but then I want to make sure I relay this message as well that they can also occur in other conditions. So if you notice new or persistent symptoms, it's best to check with your GP rather than self-diagnose. So for many people, early hemorrhoids settle with simple measures. So like eating more fiber, having more fluids, avoiding straining or taking stool softeners, or not sitting for too long. Very often it does settle down if you have early hemorrhoids, but not the severe ones.
I was talking to my nephew, and he said, "So you told me not to sit for too long." And I've never been doing it. I mean, so I work a lot from home. So I walk every hour, I'll go for a little walk in the backyard. And my nephew said to me that one of the issues the younger people are having more hemorrhoids is because, he said, is it because they sit on the cot with their phones and they're scrolling? And, the position is so wrong. Is that one of the reasons, or is because
Yeah, so in fact, I've had one of the videos that it's mainly shouting out to the younger teenagers to say
yeah,
not to read newspapers, read books, or play with your phone in the toilet.
yeah,
Um, when you're sitting down, the lowest part of your body or your torso is your bottom.
yeah,
And when you're sitting in a toilet bowl, it's not supporting it. So gravity is a magical thing in this sense. It pretty much pulls all the blood in the bottom, and the longer you sit there, the longer the pulling of these blood vessels. So everyone has blood vessels, but often these blood vessels around the anus they are normal, they are small, they're not swollen at all. So if you sit there for a long time unsupported, that's where problems will occur.
I still have to buy that step that you told me to. I haven't done it, but I have
You
to.
have to do it. So I always tell my patients and clearly yourself that in the olden days before they
Yes,
designed the toilet bowl, um, our ancestors used to squat fully on the
yes,
ground
the hole in
to
the ground.
yeah, that's right. To defecate. They don't half squat because half squat, when you're in a half squat position, which is similar to when you're sitting down with your knees 90 degrees um, on the floor, the pelvic floor muscle pulls the bowel in a certain angle. So your rectum and your anus has a kink. And naturally, you will want to be pushing or straining to empty your bowel. So that's actually not the right way of pooing. So I strongly recommend, whether it's a young person or a grown up, you get your own footstool, put it in the toilet, put your legs up on the footstool when you're pooing. So when you're in that position, which is simulating a squat, essentially what happens is your pelvic floor muscle will relax, and then your rectum and anus will straighten out so that you don't have this inherent strain when you're trying to poo. So that's the proper way of pooing.
Thank you. What are some, well, you've just talked about what are the do's and the don'ts. So, do you see a gender difference, for example, in how men and women approach this issue or how comfortable they feel when asking for help?
That there are definitely some differences I find. Not so much who gets hemorrhoids, but in terms of the differences in how people actually deal with them. I find that women often bring it up slightly sooner than the men, especially if they've had children before. Pregnancy and childbirth are common times for hemorrhoids to appear. So many women have already talked about it with their GP or their midwives, and that kind of normalizes the conversation a little. Whereas the men, on the other hand, sometimes they tend to put it off. Not that they don't notice the symptoms, they actually do. It's more that talking about bowel habits or discomfort in the area can feel a bit awkward to them. In some cultures or in older generations, these topics just weren't discussed. So there's still a bit of hesitation in that sense. What I try to reassure people is that this is very normal kind of problem, and doctors deal with it all the time. As I said, whether you're male, you're female, the key is not to let embarrassment delay you from getting comfortable again, delay you from accessing your GP or a specialist. Most of the time, these issues are simple to treat once we know what's going on. That is. Mm.
Absolutely. So, we talk about bowel cancer, which is what we were going to talk about initially. So, you said to me there is a rise in bowel cancer among younger people,
Yeah.
people as young as 15 to 29. What's behind this trend, and what should young people know about the risk?
So this rise that we've seen in the young people is not just in Australia, but actually around the world. Especially in Australia, our stats have shown that in the last 3 decades, the number has increased, the incidence has increased by about 200 plus percent.
Whoa, that's a
That's a
lot.
that's a huge number. Um, the increase, though, appears to be multifactorial. So, one clear pattern is that people born in the 1980s or the 1990s have a higher lifetime risk. And what this suggests to us is that it's not just about aging. That puts you at a risk of developing bowel cancer. It's also about early life exposures, things like diet, lifestyle, and the environment. So I feel that there's the evidence so far has suggested that environmental factors are important in this. So modern living plays a big role. So that we eat a lot of processed food, we don't eat that much fiber, we sit a lot. There's a rising obesity amongst the people. There's an increased alcohol use. All these can affect the bowel health. So people tend to want to think about genetics when it comes to young people having bowel cancer, but that's really not accounting for these huge rise number. Genetics only account for a small proportion of them, probably around 5 to 10%, while hereditary kind of syndrome like Lynch or FAP, they do exist, and most young onset cases occur without a strong family history. So it is important to not just
Wow. Okay.
blame it on genetics. A lot of these are actually related to environmental factor. There's ongoing research into gut microbiome and early antibiotics exposure. All these are ongoing, but the full picture is still being studied and it's emerging. So in Australia, the bowel cancer screening with the home stool test, like the FOBT
Yep.
testing, that is now starting at 45. just prior to mid last year, the age of starting was 50, but they have dropped this in recent days. So if it's a positive test, you should get a referral for a colonoscopy, which is usually the next appropriate step. So for people with strong family history, say you have a first degree family member diagnosed before the age of 55, a colonoscopy should begin at about 10 years earlier than the youngest onset in your family. For those with genetic syndromes like the Lynch or the FAP, they should start their screening even earlier at the age of in their 20s, essentially. So bowel cancer affects men and women almost equally, but women may delay seeking help because symptoms can sometimes overlap with their gynecological or dietary kind of issues. So it is important to relay the message to the communities that you should not be told you're too young to have bowel cancer. So if you have symptoms and it's not resolving with your conservative measures, or either you do with your GP, that's where you will need to seek specialist help.
And colonoscopy, how soon should you do it? Because I know I've been doing it for the last 10 years. My GP told me. So every couple of years I go and I get myself checked. It's a terrible, you know how terrible it is, but I still do it. And so I was actually quite surprised when they told me I had hemorrhoids. And I was like, I just did my colonoscopy. And yeah, I had done it 2 years ago. So in 2 years, things just changed.
So when you're talking about screening for bowel cancer, the very effective and cheap kind of way of screening is what our government is doing,
Yep.
which is the bowel poo test. And that commences at 45 years. Every second yearly, you do the poo test. When we talk about screening, we mean you do not have symptoms. So you are completely fine. You don't have bleeding, you don't have pain, you're not losing weight, you don't have tummy pain, and you just want to screen whether there's a chance you could have a cancer. So essentially what the test does is that it picks up even a droplet of blood that you don't normally see that is outright bleeding. So that's why it's asymptomatic, right? And the other type of screening tool is colonoscopy. So what's the pros and cons? So I guess the FOBT testing, which is the poo test, is non-invasive. Whereas the colonoscopy, you have to have sedation. They put you to sleep, and you have to have the bowel prep. And bowel prep,
that's the worst.
I know. So it's not the most pleasant thing when you're drinking it.
Yeah.
You have to go on a liquid diet. But the thing is, it picks up why does it reduce mortality in bowel cancer is because it picks up polyps. So the pre-malignant polyps, we call them adenoma. So that's a general term for it. So these adenomatous polyps, they have the potential of becoming a bowel cancer. So not all of them will become bowel cancer. Some of them will. So that's why when we see them during the colonoscopy, we remove them. Because we want to reduce your risk of transformation into a bowel cancer. So to answer your question, unfortunately, screening colonoscopy is not Medicare rebatable in Australia.
I know that.
Yeah, so unless you have a family history, as I said to you, with someone that's been diagnosed less than the age of 55, or you have a familial type of syndrome, then you can usually access to a screening colonoscopy much earlier.
Okay.
But usually colonoscopy is introduced when you have symptoms. So screening and symptomatic colonoscopy is quite different.
I want to talk about some myths and misconceptions. So some people have asked whether the rise in bowel cancer or colorectal cancer may be related to COVID-19 vaccine. From your experience and your perspective as a surgeon, what does the evidence actually say about this? And what are the real reasons why we are seeing this increase? You've told me the reasons why we are seeing the increase, but what about what people have asked me about whether, it's the COVID vaccine that has led to the rise in cancers?
I think that's a really good question. And it's one I completely understand why people are asking. There's been so much information and uncertainty over the last few years that it's natural for people to wonder whether these things are might be connected. So at this stage, all the evidence we have from large international studies and ongoing safety monitoring is that it shows no link of the COVID-19 vaccines to bowel cancer. So the vaccines work by helping the immune system recognize and respond to infection. They don't alter your DNA or cause the types of long-term changes that can lead to cancer. Like any medical treatment, vaccines can have side effects. Don't get me wrong.
Yeah, sure.
Most of them are mild and short-lived, such as fatigue, headache, or soreness at the injection site. The more serious reactions are rare, and these continue to be closely monitored by health authorities here in Australia and around the world. So the rise in incidence, especially in the younger people, um, actually started well before COVID-19 or the vaccines. We've been seeing the pattern since 1990s.
Wow,
It's
wow, nearly 30 years ago.
Yes, and it's likely related to the mix of lifestyle, as I mentioned earlier, and the environmental factors, the modern diet, the higher body weight that we have, and the amount of processed food that we're eating, the less physical activity. So, um, all and the possibility of early life effects on the gut. All right. So, one factor that might have contributed in recent years, though, is the actual pandemic itself. So not the vaccines though. So
Because
many
people were stuck
people,
at home.
yeah, they're stuck at home. Many people delay medical checkups
Yep.
and cancer screening due to the lockdown. So some cancers will pick up later than they might otherwise have been. So while it's understandably that people have questions, the scientific evidence is very clear. The COVID-19 vaccines does not cause bowel cancer. The rise has increased prior to the vaccines. And the real focus should be on the things we can control: eating well, staying active, not ignoring your symptoms, and keeping up with screening. Those are the steps that truly help protect your bowel health and save lives.
Thank you. What are some common myths about bowel habits that you hear,
Uh,
bleeding, bowel cancer, that you would wish people would stop believing in?
I have a few. So
Okay.
it's just hemorrhoids. Not always. Persistent bleeding really needs to be checked. You can't just say, just because I visibly have hemorrhoids, it's my hemorrhoids. It is very important to make sure that you're not bleeding more proximal, like higher up in your bowel. Because, as I said to you, these symptoms can be shared by other conditions as well. And the last thing you want is to miss a sinister cause. And the other thing that I often hear is, I'm too young for bowel cancer. Sadly, not anymore, based on the statistics that I've just said to you. The other thing is, I'm fit and I eat well, so I'm safe. I mean, good habits does help, but they don't make anyone immune to bowel cancer. And one last one. A normal stool test means I'm clear. It's an
That's what I
excellent,
remember I said to you, that I've
yeah,
just done a bowel cancer test.
yeah.
Yes.
So that's a common phrase from patients. It's an excellent tool. Don't get me wrong. FOBT testing is
No. Yep,
very
yep.
good at mass screening, but it's not perfect. Nothing in this world is
Nothing is
perfect. Nothing
perfect.
is
Absolutely.
100%. So, and early cancers can be very silent. So don't wait for severe pain or severe weight loss, severe bleeding, or like, not everyone presents like a textbook. So you need to, if something is not right, don't sit on it. You just need to see your doctor and get it assessed.
Thank you. So this is where we come. In multicultural communities, including South Asian families, topics like bowel health is absolutely a no-no. You feel awkward or it's
Mm,
even a taboo. Do you see the stigma affecting how soon people seek help?
mm.
Like I told you about someone who's been suffering from it 5 years. but
That's
she
right.
will not go through surgery because she's so scared.
I think in many South Asian or multicultural kind of communities, bowel or rectal symptoms can be seen as very private or very shameful, especially for women. The modesty,
Yep,
that kind of modesty can lead to significant delays in diagnosis, unfortunately. And that's one of the reasons I value things like this, like the podcast, the awareness campaign, the GP education. They help make these conversations normal and safe.
yep.
I think when people hear messages in relatable or culturally respectful kind of ways, they're more likely to act early. Bowel cancer doesn't discriminate by culture or background, so neither should our awareness or care.
Absolutely.
Mm.
So, when can families create more open, stigma-free conversations around these topics at home, especially when it involves older parents or younger kids? And I'm worried about both younger kids, 15 years. I mean, that's the one that I'm really surprised and shocked, actually. I wouldn't
Yeah.
have known. I said to my colleagues this afternoon, and none of them knew about it.
That's right. A lot of awareness actually starts at home, and as we all know, we need to make bowel health just like another part of your health talk, like blood pressure or like exercise. We tell our
Yeah.
kids to exercise. We tell our kids not to be sedentary. So this should be part of the talk. If someone mentions bleeding or a change in bowel habit in at home, you have to respond with care. Yeah, something along the lines, that's not normal. Maybe you should see your GP. It doesn't have to be awkward. In some cultures, people avoid talking about illness in general for fear of bringing shame or worry to the family, but reframing it as staying well helps. You don't make your family worry about you. When you seek help early, you get it sorted early, you get cured. So when families, especially women, share reminders about screening or talk openly, it actually normalizes the topic and breaks down the stigma. And for GPs, it's a good reminder to ask gentle, open kind of question. Patients from this background may underreport symptoms frequently. So when you ask open-ended kind of questions, it may help bring up a problem that they may not want to share with you initially.
I think because of the cost of living, it's gone up so much. Lots of people who can't afford to go to a GP are just staying at home and just not getting checked because there is no more bulk billing, no matter who you go to. So, is that one of the reasons why people are ashamed, or is it because of affordability? Um, and if you go for surgery in the public system, it doesn't happen openly because I know when I went to my primary care, they were like, either why don't you, if you go to the emergency department, there's a 5 hour wait, and I said I'll bear the pain and wait for my GP. But many
Mm.
people, and if you go public, the wait can be months, isn't it? What do you do then?
Well, we are subjected to the public wait list, unfortunately. We have
Yeah.
to we don't have that many resources. Our resources essentially is quite limited. That's
Yeah.
why we have triaging. So it is very important to make sure you relay your full symptoms to your doctors, and your doctors should assess the prior and prioritize what category you should be in depending on how severe your symptoms are. So unfortunately, you won't be able to get a service where you see a doctor in the public today for your hemorrhoids and you get your hemorrhoidectomy within the week or within two
Yep.
weeks.
I was
And
just fortunate.
it it will need to be prioritized,
Yeah.
and it is a wait. But if you have any sinister symptoms or any symptoms that we are suspicious of, usually that get expedited as well. So even if you're on a wait list, and let's say you've waited for 3 months and you still have not heard of a date for your surgery, but you're getting worse or you're having new symptoms, that's when I would say you need to look after yourself. It is expensive to see the GP because there's no longer a bulk bill,
Yep.
but everything else in life is expensive too. When it comes to prioritizing, you have to prioritize your health. Seeing your GP or, getting in touch with the public system again to say you have now developed these symptoms. And naturally, the team usually would expedite it for you, depending on what symptoms they are, and whether or not there's anything that sounds very sinister.
Thank you. Um, well, we've just talked about, what would you say? What would you say to your patient who's scared, ashamed, and I think worried? I was more worried than anything else, but I suppose I was ashamed when I was talking to people. I'm like, oh no, this has happened, and they're like, oh, it's happened to me when I'm pregnant, when I'm this, when I'm that. Yes, it's. I think so much of embarrassment and shame. I don't know about the worry part of it, but
I feel that a lot of the fear and embarrassment really comes from not knowing what to expect.
yeah,
And in many cultures, especially the Asian and other culturally diverse communities, there's this feeling that you just don't talk about illness or anything to do with your bowel.
absolutely,
It's
yes,
seen as impolite often in an Asian culture, or even a bit shameful. So people often want to wait until things get quite advanced before they start seeking help. I see this quite often in my own practice. Many come in apologizing for even bringing it up, and some apologize when I have to examine them. But I try to I keep them safe. Make sure they feel safe. I run through what I'm doing with them. I make sure that they feel like they're respected. I tell them there's really nothing embarrassing about it. It's part of my job to assess so that I can better inform them what kind of treatment suits them. So it's just another part of the body, and my job is to help. I'm not there to judge. So I always try to explain things very clearly in plain language and to slow the conversation down a little. Once people understand what's happening with diagrams or it often helps them understand what the anatomy is and what's going on. And the fear or the embarrassment significantly, I find, reduces. So in the end, I think kindness and calmness really matters most in these situations. When someone feels that you genuinely care about them, that you are listening and not rushing them, the fear starts to fade, and that's when trust begins to build.
thank you. So, one practical step and advice to our listeners on how to protect bowel health, what would you say to them?
Oh, I got so many.
Okay, let's have as many as you want to share.
I think if there's one thing I hope people take away from this podcast today is listen to your body and not to brush things off because you're busy, you're embarrassed, or you think you're too young. If something feels off, bleeding, a change in your bowel habits, or you have unexplained pain, please just see your GP. Most time, most of the times, it's nothing serious. But if it is, catching it early can really make a difference. And to those from the Asian or other multicultural backgrounds, I know it can feel uncomfortable to talk about these things, especially in families where illness is seen as something very private. But protecting your health is one of the best ways to care for the people you love. So at the end of the
Absolutely.
day, bowel cancer doesn't care about age, doesn't care about your culture, your background, but awareness does save lives. So start the conversation and don't wait until it's too late.
Thank you. Thank you so much for joining me today and for your kindness, expertise, openness. And I'm so grateful for what the care that you gave me and everything you did to support me and also doing the interview for me for work. And thank you. And
My
to
pleasure.
everyone, and to everyone listening, please don't ignore small symptoms. Like Suat said, don't be embarrassed to ask questions, whether it's pain, bleeding, or change in bowel habits. Your health is worth speaking for, and that's exactly what you said. And if this conversation has helped you, please share with someone in your family or community. Sometimes that's how awareness begins. One honest chat over chai. Thank you for listening to Chai Chat and Community. Stay curious, stay connected, and take care of yourself. Thank you, Suat.
No problems.